Ready.
Good afternoon, everyone. I'm Pam Brandon. Welcome to the virtual road trip. And as all of you are getting on to and getting comfortable, I will tell you that we are very excited to be traveling to Ontario, our first international road trip for the year. And so we're kind of having a dual trip here. We're going to be in Ontario and Washington, D.C. at the same time. So I see the participants growing quickly on here. And so welcome everyone. I hope your day is going well and your week is going well in this uncertain time that we have, that it seems like we're all getting more used to. So it's not quite as uncertain as it was before. So I want to start by just welcoming our guests. I'm very excited to have these folks presenting. For those of you who don't know this, I started my work in family caregiver education. That's how I got started in this space, and it was because I was a family caregiver. So when Jonathan and I met and he told me what he did, I was just very excited, because that is definitely and will always be at the core of so much of my passion here. So very excited to introduce our team from Trualta, Jonathan Davis, who is the founder and CEO, as well as Mijal Vonderwalde, who is also with Trualta and is the researcher. And very excited as well to have John Schall, who is the CEO of Caregiver Action Network. And for those of you who do not know about Caregiver Action Network, they do amazing work. They do such important work in reaching caregivers. And I'm sure that the team will agree with me when I seem to say this often to our providers and other stakeholders, that as we see the millions of growth, I mean, I know that it's somewhere, John, you'll be able to probably connect or correct me on this, but I think the latest number I saw was 65 million caregivers, family caregivers in the US, close to 10 million in Canada. So we're talking about hundreds of millions of families who are caring for their loved ones. And as the aging population swells so quickly, those numbers are going to increase greatly. And my soapbox statement is always that if every single one of us who were stakeholders in this space were to support our families, there would still not be enough. But and that's why I'm so passionate about all of us taking this very seriously, that we have reached a public health crisis. And certainly COVID is just putting that, I think, that issue to the forefront more than ever, that we need to do more to support our families. And there's only so many public dollars to do that. So we all have to be in this together. So with that, they have important things to share, and I don't want to take up your time. So I'm going to turn it over to Jonathan and Mij and John to talk about their groundbreaking work in family caregiver activation. So Jonathan, and Mij and John, I will let you take it from here, and we all look forward to hearing what you have to share with us.
Great. Well, thank you, Pam, for that warm intro and for having us today. And thanks to all of you for joining us. We are very excited to be part of AGE-u-cate's virtual road trip, and so happy to see how much the topic of family caregiver activation resonated with all of you. So today we're going to talk about how to successfully activate families with caregiver interventions, specifically for family members caring for aging loved ones with dementia. I'm Jonathan Davis. I'm the founder of Trualta. We developed a tech-enabled education platform for family caregivers that we offer across the US and Canada. And I started Trualta a couple years ago after working with education companies and education companies that train professional caregivers and clinicians. And we realized there was fantastic content and methodologies available specifically for seniors aging in place with cognitive decline and dementia. And so much of this great content wasn't available to the families who needed it most. So with Trualta, we've adapted professional level training to the untrained family caregiver audience. I'll pass it over to Mij to introduce herself.
Thanks, Jonathan. Hi, everyone. I'm Mijal Vonderwalde. I'm on the research and content team at Trualta, and I work to ensure that our program is informed by the best and the most current evidence. And I'm also a registered occupational therapist with hands-on experience working with older adults, as well as some research and academic experience in health behavior change. And I'll pass it over to John.
Thank you, Midge, and hello, everybody. I'm John Schall. I'm the Chief Executive Officer of Caregiver Action Network in Washington, D.C. Caregiver Action Network is the National Family Caregivers Association. So we are the leading nonprofit U.S. consumer-facing organization that helps those really 90 million Americans across the country who are caring for a loved one with frailties of old age or chronic conditions or some other illness. We've been around since 1992, and we have developed, I think, quite a bit of expertise in all the years of doing this on what the needs and challenges that family caregivers face.
Great. Thank you, John and Midge. So we'll start off today by introducing both organizations because so much of what Midge and our team developed around caregiver activation is based on our experience engaging with families across the US and Canada. So we partner with home and community-based organizations, healthcare providers, and payers to offer Trualta to families in a print and digital program, usually offered during a home visit, at point of care, by a case manager, social worker, discharge planner. And now in the times of COVID, we often offer the intervention over the phone. Families receive a personalized learning journey, everything from 5-minute tip sheets to 3-hour modules. We deliver audio, video, interactive resources, and it all comes through our sort of learning management system that was built specifically for the caregiver audience. We've adapted professional level training for the untrained family caregiver, and we conduct extensive research and clinical validation to prove to healthcare and social service stakeholders that confident, trained family caregivers can reduce costs and improve outcomes.
I want to take a minute or two and tell you a little bit about the Caregiver Action Network, and then secondly, why we're here with Trualta in talking about this today. As I mentioned, Caregiver Action Network is the nation's leading consumer-facing nonprofit for those family caregivers across the country. So if you're a real-life family caregiver in Iowa or wherever, and you need some help and support, education, resources, we're the ones you reach out to. Obviously, it's our mission to make sure that family caregivers are as prepared as they possibly can to meet these daily challenges. We do a lot of training for caregivers, both in person and virtually, and we actually do it across the lifespan. So for us, we have to worry about family caregivers of parents with special needs, let's say autism on the child side, as well as Alzheimer's on the elder side, and everything in between. So it really spans the spectrum of all disease conditions across the lifespan. It's also interesting that we have to focus on really 2 main buckets of challenges for family caregivers. One, the nuts and bolts of how to do caregiving, and then secondly, these, for lack of a better way of describing it, psychosocial issues that come along with caregiving simply because of the stress of the role. Depression, anger, guilt, all those things that caregivers feel. We are just so pleased to be doing this today with Trualta in terms of caregiver activation for a couple of reasons. One, I mean, we've known in the field that for years and years and years, we've been talking about patient activation, what that means, and how it translates into better health outcomes for patients. And now the field is ripe for exactly the same sort of work on the caregiver activation side. And that's what Trualta has pioneered. And that's why we're so excited about it. One, not only to figure out how to activate family caregivers, but also then to do the research necessary to show that that activation translates into better outcomes as well. And that's why we're just, as the nonprofit association, just so glad to be with Trualta in this effort. I think what you're seeing today is the first chapter in what's going to be a very, very exciting new story in terms of caregiver activation.
Thanks, John. So our objectives today, we're really excited to share what we've learned about family caregiver activation. And in addition to providing our research findings, we'll do our best to provide you with actionable strategies that you can implement to activate the families that you work with. And we know there's a varied audience on this call. So whether you're working in a community care context, senior living, long-term care, or even just personally, if you know someone who is caring for a loved one with dementia, we want to give you a framework to think through when you are offering interventions and supports to families in challenging care situations. We also really want to hear from you. So we'll post some questions to the crowd throughout. Please answer in the chat box below. Our team is standing by to collect all the responses, and we're going to address them towards the end of the presentation. So please don't be shy. We really would love to hear your thoughts.
All right, so we think it makes sense to start with a definition of what caregiver activation is. So it's the process by which family or friend caregivers become ready and then progressively assume the multiple roles that are involved in managing the health of individuals living with dementia, while also caring for themselves. And just a note here, we should mention that while most of the research we did was specific to dementia caregivers, we did conduct an extensive review of existing interventions that covered a wide range of care situations. And so that's the research definition, but as Jonathan mentioned, we'd really love to hear from you. What does caregiver activation mean to you? What does it look like? What are your thoughts about it? Please feel free to share your thoughts in the chat box and we'll be sure to summarize them later.
So our journey into caregiver activation stemmed from a recurring question our team encountered. Organizations frequently asked us which families they should engage with caregiver programs. Staff really wanted to hear eligibility criteria, but we became very reluctant to provide any. We saw engaged users of our platform that were 80-year-old partners or 30-year-old sons and daughters. Some lived with their loved one, others didn't. Some were caregiving full-time, others were juggling work and care responsibilities. Instead of providing criteria, we wanted to understand how to activate caregivers so that we could help our partners ensure that our program was impactful for the families that they served, really whoever they were. So now that we've talked about what caregiver activation is and why, in terms of why it's so important to us, I'm going to pass it to Midge to discuss the how.
Thanks, Jonathan. All right, so although we had seen the concept of caregiver activation floating around, it seemed that no one had really answered the question, how exactly do you activate a caregiver? And so in order to answer that question, our team began by conducting a literature review of over 50 relevant academic articles about online interventions, many of which were specific to caregivers of people with dementia. And we read each study and analyzed all of their successful implementation factors. So coupled with our own caregiver data and insights, we quickly discovered that there were two main things to consider. One, caregiver readiness, and two, intervention engagement. But after establishing these two categories, we knew there had to be more. So we went back for another round of thematic analysis to really understand how caregiver readiness and intervention engagement were related to caregiver activation. And eventually our work led us to capture the mindset and the behaviors of an activated caregiver in a series of 6 statements, which are the statements that you see on the screen. But what exactly does that mean? It means that through the process of activation, a caregiver should be able to say each of the 6 statements that you see on this screen. And now you may be wondering, how exactly do we help caregivers say these statements and become activated? Well, that's exactly what we're going to go through today. So we're going to begin with I need help, and we'll go through each of the 6 statements. Within each statement, we'll define factors that teams should consider when developing and promoting a family caregiver program. And after each statement, we'll provide you with tangible and actionable ways to actually use the research in your own programs and work towards caregiver activation. So we'll start off with the statements related to caregiver readiness, which are I need help, this can help me, and I can do this. So when offering caregivers help and support, they need to be able to progress through these 3 statements. And the reason it's so important that caregivers are able to identify with each of these statements is that as this happens, their readiness to make a meaningful change will actually increase. So the first statement is all about family caregivers coming to the realization that they need help with caregiving. Within the I need help statement, there are 3 factors that relate to both the magnitude and the timing of the family member's need for support. So within our research, perceived need emerged as an important factor to consider because family caregivers who have a higher perceived need are much more likely to engage with online programs. Perceived need is something that's likely to be the greatest shortly after a loved one receives a new diagnosis or there's a considerable change in a care situation. For example, when a caregiver is faced with managing behavioral symptoms or wandering for the first time. And similarly, staff should consider the factor of perceived competence, as a lot of the studies also showed that family caregivers with lower perceived competence or confidence were also much more likely to engage with online interventions. So in order to really leverage these insights and use them in your own efforts, you can think about taking timing into consideration and getting to know potential family caregivers to really find out more about their care situation. We think you could use this to your advantage early on, such as when you're doing intake interviews or initial phone calls. And an easy way to do it is to add in questions to your intake process about when caregivers receive their diagnosis for their loved one, whether it's the first time caregiving, and how competent they feel to provide care. So those are the first 2. And the last factor in this statement is symptom management. And the research suggests that family caregivers tend to show greater readiness for change if they're caring for loved ones with, let's say, more serious presentation. Again, we really urge you to get to know your caregivers and understand what symptoms they are caring for and managing at home. Because more serious symptoms like higher behavioral symptoms and lower cognition can actually help you flag a family caregiver that could really benefit from your program. So when caregivers realize that they're not currently equipped to care for their loved one and that they need more in order to help manage their loved one's symptoms, they'll be able to truly say, I need help.
Thanks, Midge. After each statement, we're going to provide a bit of an example from our experience to sort of bring that statement to light. And Ralph here on the screen is an example of why we don't have eligibility criteria for our program, and instead we focus on caregiver activation. Ralph was an older caregiver. He wasn't particularly technologically inclined. He was caring for his wife for the past 4 years. So it wasn't a recent diagnosis. He wasn't at the beginning of his caregiving journey. He was actually quite experienced. Ralph's situation was also unique because his wife became agitated if anyone came into the home, including his case manager. So he actually really needed a remote intervention. Ralph was calling his case manager frequently, very upset about his wife, and so she offered him Trualta. And we're going to come back to Ralph later in the presentation. He's an example of why we don't have eligibility criteria, and we don't think that's what's important. What's important is how we activate Ralph, and we'll talk through his outcomes towards the end of this presentation.
All right, so next we have This Can Help Me. So it's extremely difficult to activate a family caregiver who doesn't see the potential value of an intervention, a program, or a resource. So the belief that a resource can help caregivers is cultivated by 2 things. 1, initial expectations, which describe the caregiver's beliefs that a program will actually result in the benefits that it's claiming to produce. And 2, intervention credibility, which depends both on the source of the content and the style that it's presented in. So the best time to help family caregivers reach the statement of this can help me is when staff first introduce a program. So in order to build the family member's initial expectations and foster the belief that the resource will result in the benefits that you're explaining, you can begin by letting them know about previous successes. So for example, if you're trying to get someone to go to a support group, you can try saying something like, this has really helped another caregiver in a similar situation. And this is just one of the strategies that our organization uses. But my next question for all of you is, how do you make sure that your caregivers know that your program can help them? If you have any creative ideas, please put it in the chat box and we'd love to discuss them later on as well. I'll give everyone a couple seconds to think about some ideas.
Yeah, we're already getting some great ideas in the chat box. Thank you for participating, everyone. I know that folks on this call have lots of thoughts on this, so please don't hold back.
Absolutely. All right. So it's also important to make sure that your introduction isn't just you telling family members about the program or the resource. You'll also want to take the time to show them it too. So your program introduction is a great time to leverage any professional and appealing program material and really use it to foster that credibility. And lastly, and I cannot stress this enough, is practice, practice, practice. You don't want to let your first caregiver be your first caregiver. So we recommend that you practice on your fellow staff members and do trial runs before introducing the program to a family member, because a confident staff demonstration by you will also help foster credibility in the resource or the program. So when caregivers believe that your program will result in the benefits that you claim, and they have a chance to develop a sense of trust in the program, they'll be able to say and believe, this can help me.
All right. So we are seeing some great ideas come through in the chat box. We'll tell you about a couple things we've learned about how we demonstrate credibility and show caregivers that this can help me. So 2 examples. The first is that we originally printed material as marketing for agencies to see the quality of the content and how we'd adapted professional level training to the family caregiver context. But we learned that the printed material was actually really important for the caregiver to see. We printed a high quality, caregivers hold the material, they see it can help them, they understand that it's credible, and they're way more likely to get activated when they have print material. It's not a tech solution, but we learned how important it really was for activation. The second example I'll share is that when we started rolling out Trualta, we started to see that some staff members were really good at activating caregivers and others not as much. So we ramped up our training and even included a quiz. And in the first question we ask at the end of the Trualta training is, how would you describe Trualta to a caregiver in 2 sentences? So we ask staff this once they've onboarded to the program, and our team reviews every answer. Because even though the case manager or social worker or care coordinator that's offering the program isn't a salesperson, and of course no money is changing hands, they ultimately have to sell the intervention to the family so that they can say, this can help me.
All right, so our third statement here is, I can do this. So we know that families are busy with work and caring for their own children as well, and they're constantly juggling their various roles and responsibilities with caregiving. So that's why in order to support a caregiver in becoming activated, a caregiver must believe that they already possess any skills or attributes that are required to use a program or to access a resource. Otherwise, if a caregiver believes a program is too hard or too complicated, they're unlikely to stick around and continue using it. And actually, in one of the studies that we looked at, and that was analyzing factors affecting individuals' intention to use an online caregiving program, perceived ease of use was the only factor that predicted future engagement. And similarly, those who already possess what we call technology comfort are also much more likely to engage with programs not only sooner, but actually end up using them more often. So when caregivers see that a program is easy to use, and they become comfortable with the technology required, they'll be able to say, I can do this.
So to help caregivers say, I can do this, the online resources should be designed with simplicity and user-friendliness in mind. But what does that mean for you? Although your current registration processes may well include long intake questionnaires or surveys, these are often viewed as onerous and time-consuming by caregivers. We've discovered in a lot of these instances, the more information that a caregiver has to give you up front operates really as a barrier to the caregiver finishing that process and beginning the program. The Trualta team actually found that simplifying and shortening the registration process for this program was a great way to convey that the program is easy to use and to foster technology comfort among the users. And doing this actually helped increase the engagement in the Trualta program. So if you're thinking about how this strategy could work with your current processes, but you know that your organization will need, specific data like things like annual reports, remember that you can always take advantage of online surveys or other vehicles to collect that data on an as-needed basis in the future, so it doesn't act as a barrier in the first instance. We've also found that agencies and organizations all too often underestimate the technology comfort and connectedness of their older users. For example, these comments that you see on the screen were posted by a 79-year-old caregiver who logged into the Trualta program more than 25 times and actually worked through 93% of the entire platform. So instead of shying away from older users, you can help foster their technology comfort by dispelling any myths or preconceived notions that they might have, like those relating to sensitive topics like data privacy. And don't underestimate how tech savvy they may well be. I remember a few years ago, November 1st, November is National Family Caregivers Month, and on November 1st, the president issued a proclamation. This is something that CAN leads nationally for the month and actually gets the president to issue a proclamation. Well, about 10 minutes after issuing this proclamation on the morning of November 1st, we were constantly barraged with several emails from one of our caregivers across the country. Why haven't you put the president's proclamation up on your website yet? Well, I discovered that that caregiver who was barraging us, quite rightly, was 92 years old. Obviously, we've learned since then to make sure that the presidential proclamation now is out within the first minute that the White House issues it. But the point is, don't underestimate the tech savviness of older users. And certainly in a COVID environment, where caregivers are online, a previous Pew Research study showed that caregivers were actually twice as likely to be online looking for health information and help than non-caregivers. And older users during a COVID environment who now may have experienced telehealth situations for the first time, actually being able to use FaceTime with their grandchildren, et cetera, is not the time to be underestimating their tech savviness. So another one of these questions, if you could, please, if anyone else has a story about an older caregiver who is really engaged, we would like to hear those. So if you could post that in the chat section as well, we'd like to hear it and be able to discuss those at the end as well.
Thanks, John. That's a great, telehealth during COVID is a great I can do this example. I like that a lot. So to give you a bit of a recap, at this point, you know your caregiver is ready to make a meaningful change. Oh, sorry, I'm out of order here. Quick recap. We went over the first three statements. I need help, this can help me, and I can do this. We are really enjoying hearing all your thoughts in the chat box. Many of you are sharing them with only the panelists. Feel free to share them with all attendees because I know these ideas are going to be used by all and really appreciated. So please, when you comment to all attendees because we're getting a ton in the panelist chat box that we'd love everyone to see. The other thing I'll say is I know Midge and I are giving, and John, a ton of information about the research behind these three statements. At the end, we'll give you a link to download the full ebook. It really goes into a lot of depth about all the research that's behind the framework and a bunch more examples. So if you're taking notes or trying to follow along, we know there's a lot of information. We'll give you a chance to catch up at the end. The ebook's really helpful.
All right, so as Jonathan was mentioning, at this point, you know your caregiver is ready to make a meaningful change, but now it's really about how you engage them with whatever program it is that you're offering. So we'll now move on to discuss the features and the formats that can help you and your caregivers be able to say the next three statements, which are this adapts to me, this has my attention, and this is making a difference. So as Jonathan mentioned before as well, we're firm believers that there is no one-size-fits-all solution, and it's part of why we don't believe in strict eligibility criteria. So caregivers are a diverse population, and programs that cater to the individual and adapt to different circumstances are the ones that'll reach the most users. So what this means is when creating a resource or a program, you can do this by considering convenience factors like easy accessibility and shorter time commitments, and also by considering flexibility in your program design in order to remain relevant for caregivers whose care situations might change over time. But perhaps most important of all, a program that actually prioritizes personalization will foster a caregiver's motivation to engage and get them to stick around with the program for long term. So by making your program or your resource convenient, flexible, and personally relevant to each caregiver, they'll be able to more easily say, this adapts to me.
Thanks, Midge. We see in the data that caregivers are far more likely to become activated if the program is personalized to them. And we consider a range of factors to help personalize. So let's look at this example together on the screen, how we promote this adapts to me. So in this example, we pulled a few facts about Barbara. We know she's age 60. We learned all this kind of as she was engaging with our program. Because of her high level of stress and loss of personal time, her personalized learning journey included shorter modules. She feels somewhat competent, so we go a little bit lighter on skills, and instead we focus on wellness with someone like Barbara. But not all profiles are the same. And pushing material to Barbara that doesn't feel relevant to her situation will certainly not help activate her. So a question for this group and any of the panelists as well, but please share your thoughts in the chat box. With this profile, knowing what you know about Barbara, what interventions or supports would you recommend to her?
And I'll jump in there for a second if I could, Jonathan, because this point about personalization is really fundamental. In our many, many years of doing this with family caregivers, we've realized that they really kind of have two buckets worth of challenges and needs. One, these kind of nuts and bolts issues that come with caregiving that, frankly, none of us is born knowing how to do, which is why a Trualta program that helps train them is just so important. Because think about it, more than half of those family caregivers across the country are actually performing pretty sophisticated medical tasks at home that we would normally associate with nurses. So there's that nuts and bolts, but then there's also these sort of psychosocial issues that come to bear with a family caregiver. And Barbara here is a very good example. She may have some competence, but at the same time, because of the stress, you want to be able to talk to her about issues like depression and anger and guilt and taking care of herself. All that other side that comes to bear for family caregiving and shows that the program adapts to them personally.
Absolutely. All right, so I'm seeing some good responses here, so please keep those coming in. This next statement is, this has my attention, which speaks to a program's ability to stand out. So family caregivers receive an abundance of information and resources from healthcare practitioners, from case managers, and even their friends. That's why this statement is all about strategies that you can use to stand out, to help retain caregivers long-term, and to meaningfully impact them. So to promote engagement, usability, and enjoyment, a program should be multimodal. And this means that you should be using a combination of modalities like audio, graphics, text, videos, e-learning, vignettes, and even animations to deliver your content in an impactful way that promotes engagement and enjoyment. So I know we've all probably had to do those tedious compliance e-learning trainings, and we know it can get a little boring. So having multiple modalities is something that helps you provide content and resources in a compelling and a relevant way to help your audience truly benefit from the information. So my next question is, I know everyone has a preferred learning style, and I want to know, if given the option, how would you consume information? Through an online article, a printed article, interactive e-learning maybe, or maybe just listening to audio, or maybe you prefer variety. So please let us know in the chat section. I think we'll all be surprised at what a variety there is in preferred learning styles and just how important multimodal features can be, especially when engaging people online. And I'd like to hear from the other people that are speaking with me today. So John, do you have any thoughts on this benefit of using multiple modalities?
Yes, absolutely. And I think that's why we're going to find it so valuable for you guys to put in the chat box your answer to that question. What modality would you kind of naturally gravitate to if it were you. We have certainly learned over the years that we have to be prepared to deliver materials, information in all of these modalities, because there's somebody in every bucket. And so you really can't rely just on one or the other. It can't be video by itself or articles by themselves. You really have to have some of each. That's the key to having wide engagement. It's also worth keeping in mind something we learned, that not everything can or should be long. Some things have to be short, or some things actually can be short snippets that are a preview of something that's longer. We have discovered that if we can give people a 60-second snippet of something that's going to be 20 or 30 minutes, by first doing the 1-minute snippet, they are much more likely to do the 20 or 30 minutes. So it's just one of those you have to go through every modality, and it'll be fascinating to see what all of you say on the phone in terms of your experience with different modalities.
Thanks, John.
Absolutely. Yeah, I already see a bunch of different answers coming in, so it really speaks to that as well. And one last thing I wanted to mention about the other factor in this has my attention is it's also important to note that retaining family members' attention can't be done by the program alone. So having supplementary support is also a key feature of any online program, because it helps to increase adherence to your program by keeping family members accountable. So some examples of supplementary support can include things like personalized emails, text messages, phone calls, or even face-to-face meetings at regular intervals. And the reason regular support is important is because a one-time check-in just isn't enough to retain a caregiver's attention. So we really recommend thoughtfully wrapping the program in a support system, and that can actually help you retain the caregivers for longer-term commitments, again, as I mentioned, by increasing their adherence. So by providing a range of options to engage and supporting them along their journey, caregivers will feel and say that this has my attention.
Excellent. Thanks, Mijal and John. Those are great examples. And we know, and I know lots of people on the call will agree, keeping caregivers engaged is no easy task, given how busy and often overwhelmed families are when managing care at home. So as we mentioned, varied delivery and varied time commitments are important. An audio can be played in the car or while in the waiting room, waiting for an appointment. Tip sheets can be printed and referenced frequently. So we think it's really important to offer a variety. But that second factor, we also really need to facilitate that supplementary support. So what we learned when we were building our intervention was that we had to build a lot of features for the organization and the staff person, dashboards and customization opportunities, so that the caregiver felt really wrapped in supplementary support and not on their own trying to navigate.
Okay, and this last statement is, this is making a difference. And this statement is ongoing, and the caregivers won't suddenly arrive at it through an epiphany. So a caregiver program should give the users of it the opportunity to recognize their achievements along the way in order to foster benefit recognition. So because caregivers who recognize that a program is helpful and worth their time, they're more likely to continue to use it. And it can be something as simple as receiving positive notifications or praise when a certain goal or milestone is reached. And lastly, we have caregiver self-efficacy, which is one's personal self-confidence regarding their ability to perform a specific behavior. And caregiver self-efficacy develops due to a culmination of the strategies that we've discussed in all of the other statements. And this is really the ultimate goal of any caregiving program or resource. Competent caregivers that believe in themselves and their ability to care for their loved ones. So in order to hear someone say, this is making a difference, don't forget to check in with your caregivers to reflect on their great progress and take some time to think about all the strategies that we've discussed today and how you could potentially apply them to your own programs and your own caregivers. And so that's my last question for all of you today. If there's one thing that you've learned throughout all of these statements that you could use to better engage your caregivers in your own programs, what would that be? I'm really curious to know.
All right. give everyone a second if they want to share thoughts in the chat box before we provide our last example here. You know, to wrap up this sixth and final statement, we'll go back to Ralph. So as a reminder, he's a 85-year-old caregiver looking after his wife with Alzheimer's for 4 years, not necessarily the typical profile for an online intervention. As I mentioned before, he really only used email and maybe checked the weather, but he was able to log in and use Trualta every few days in his first month. His dedication was really amazing. He actually completed 75 quiz questions, including professional level content from TIPA Snow and others. These are quizzes that really would have earned him continuing ed certification if he needed it. And the thing about Ralph is he really recognized the benefit. He demonstrated self-efficacy, he built skills, he built confidence, and he saw the difference that it was making in his caregiving. And so did his case manager. He was calling her frequently very upset. She gave him Trualta, and she really saw that benefit come to light as Ralph became a confident, competent caregiver, even though, you know, he was probably older than many other users or other caregivers that we see. So we bring it back to him to show how this as an intervention is really making a difference. All right, we're going to go back to all the wonderful ideas and review some of the thoughts we got from the audience, but we just want to say thank you so much for joining us. Our contact information is on the screen, so don't hesitate to reach out if you have thoughts or questions. And we know that there was a ton of information here. So if you go to activate.trualta.com, you can download the entire ebook, and it has all of the detail behind what Midge, John, and I shared about the different caregiver interventions. I also do want to pose one more question to this group. And again, we're going to go back to responses, so please stick around as we go through. But the final question on my end is, if we had to do another webinar, what should our topic be? If you have thoughts about what you'd like us to dig into next in terms of caregivers, caregiver activation, or a totally separate topic, we'd love to hear from you. So drop that in the chat box. All right. You know, I think one thing I was thinking of, just to acknowledge the great content we got from the crowd here, maybe we go back to the definition of caregiver activation. What do you think, Midge?
Yeah, I think that's a great idea.
I'm gonna go back here so we can see the research definition. I loved Amanda's comment, helping a family caregiver to be all in and fully engaged in care, not afraid to speak up for their loved one. So that sense of advocacy in there. Balancing that with truly understanding their loved one's need and how they will be met, whether within the family or with outside assistance. So that was Amanda's definition, which I really like.
I see another really good definition that I liked here from Erin. She said, caregiving activation to me is when caregivers feel engaged, heard / listened to, and feel supported, when they feel empowered and know their options. So I think that's fantastic. And it really speaks to a lot of the statements that we mentioned, you know, with the support and, you know, being heard or listened to. It really feels like it's something that is personal to them and not just another kind of run of the mill, you know, flyers or pamphlets that you might get at a physician's office or something like that. So I really like that.
Awesome. That's great. Getting a few questions for the link. I'm just going to put it back on the screen. Activate.trualta.com to download the ebook. If you enjoyed this presentation, I think you'll really like going in deep there. So take a look. Your second question, Midge, I thought was interesting. How do you make sure your caregivers know that the program can help them? So ideas from folks out there that are delivering interventions all the time, whether it's support groups, whether it's online stuff. How do you make sure that the caregiver knows, hey, this can help you? So Crystal shared, I explained the caregiver assessment will help them develop a plan to provide recommended resources and tools in the toolbox. So they might not need all of them right away, but they're there to be used. And then, you know, always making sure, Crystal says, I'm available by phone or email so that you're wrapped in supplementary support. That's a really important point. Thanks, Crystal.
Definitely. All right, another question that we asked, Jonathan, if we could go back to the slide about Barbara. We asked, what are some resources or programs that you would consider offering her from your own organization? So we got a good response here from Sarah. So Sarah says that she would let Barbara identify which needs she feels are the most important first, as she has high stress. Perhaps asking open-ended questions as to what makes her feel most stressed would be a good idea. And if it's time management or time for herself, then perhaps some respite services, or maybe trying to navigate health insurance, and referring to other resources that could help with that. So definitely, I know we all work in, different areas with different organizations and different resources. So it's always interesting how, if given the profile of kind of a caregiver like Barbara, with our own toolboxes as clinicians or case managers or whatever it is that you might be, we have different ideas about how to help all of these caregivers and really customize our approach to them. So I think that was great.
Yeah, that's great. I like that. Hey, we had a couple questions come through the Q&A. So we can address those. Benjamin asks, is Trualta looking at serving family caregivers who need to move through these same steps, but when choosing a lifestyle that supports socialization, like senior living, they go through these steps too? Yeah, definitely. Definitely, we know of caregivers that are sort of in independent living, other types of senior living that will use Trualta. I mean, primarily, we do serve families that are living in a home, like a home and community context. So it really, once you transition to senior living, I think we see less maybe engagement with Trualta, but we do try to help families think through that situation. We have some frameworks and some content. We know how important sort of financial planning and all these sort of non-healthcare topics, but still content that's so important to the family caregiver as they navigate next steps with, potential transitions.
If I could throw in a thought there, it's worth encouraging family caregivers of loved ones who have already made that transition to some assisted living or in some facility, because the family caregiving role still ends up being quite critical. Certainly, if your loved one has dementia and now is in a nursing home or something, that advocacy role that one of the commenters threw in a few minutes ago is just that important, because you will have to be the advocate for your loved one. And, that will take some training to be competent on those types of issues that come up in a living facility situation. So it's one not to be mitigated, and one not to let people think that, well, now that my loved one has transitioned, maybe I don't need that much training in this. Really, quite the contrary is true.
Yeah, I agree. That's a great point. A couple other questions here. Can this presentation be shared? We really recommend downloading the ebook. You get everything that's in the presentation and more. So that was from AM. So that's activate.trualta.com. Oh, sorry. Just going through the questions here. Looking at images, what is the quiz on each one? Yeah, so all of our modules, or most of our modules, have a quiz. This is a question from Crystal. We really do like to prove that, hey, our content really did teach caregivers something. We ask them a couple of questions. They can earn rewards and badges as they go through the quizzes. We see a lot of users that love just the challenge and tracking their progress as they go. And that concept sort of taken from the idea of adult learning or training, where, gamification or just completing milestones, tracking progress is an important part of online learning. So we have that as a feature for our caregivers. And Sarah makes a topic suggestion: alternatives to finding respite care when aides are not available in your area. That's a great example. Actually, Midge, it makes me think a little bit about Alzheimer's Music Connect. It's not necessarily like a respite option. So who asked? This was also Sarah. But in our platform, we offer streaming music, similar to music in memory, where the music is nostalgic. It has an oscillating technology that's proven to have a calming effect on a person with dementia and give the caregiver a couple hours of respite. So something we offer through the platform. Again, it's not necessarily educational content with learning objectives, But when a caregiver needs some respite and music works for their care situation, they can stream the music and hopefully get a little bit of quiet time.
And if I could throw in a thought there, Jonathan, certainly music, puzzles, those sorts of things work extremely well for caring for loved ones with dementia, and I'm glad you brought them up. Yeah, there's no question that there's far too few respite services available nationally to help caregivers, meet that tremendous need for respite. So it's one of those situations, I think, where you want to have the caregiver take control of the situation. What do I mean by that? If you're a caregiver, as so many of us are, you are probably sick to death of hearing everybody ask you or say to you, if there's anything I can do, you just let me know. If you hear it one more time, I think you probably want to throw a rock through a window. The fact is, those people really do want to help, but they just don't know anything specific to offer. But if the caregiver who's hearing that then can come back with a specific, well, what would be perfect is if you can look after my loved one for 4 hours on Saturday, because believe it or not, I'm going to go see a movie. And that's what I need for respite, to recharge my batteries. That's hard to do because it's hard to anticipate a specific that you think you will need, but it's worth putting that list together so that when someone does say that, you can take advantage of it and get some respite. And also train the caregiver to overcome the feeling, as we all have, well, I better not do that because no one can take as good a care of my loved one as I can. You know what? That's probably true. So what? Get over it. You still need 4 hours off to recharge your own batteries. So for a few hours a day or something, yeah, somebody you really trust can take slightly less good care of your loved one while you recharge your batteries. And so there are different ways to get at respite, knowing that officially available services are just far too infrequent.
Yeah. Yeah, it reminds me a bit, John, of like the definition we got from someone around caregiver activation, which is that advocacy, like I need help, this is what I need. It's raising my hand and kind of falls under that first statement there. But it's a great example and something, as we develop, it's often hard to develop content specifically for caregiver wellness, but it's tips like that. It's how to really sort of advocate, define what you need. They really are caregiving skills that are a little counterintuitive, but so important. Oh, topic, caring for a parent when a childhood-parent relationship was not good. Thanks, Crystal. Great topic suggestion. All of these are going to go on our list. If we don't have them already, we will. But yeah, family dynamics is something family dynamics, definitely a topic that we hear about often, we develop content for. One thing we try to do is sort of, we call them care chats. So facilitate a difficult conversation. So the relationship might not be great, but you're telling mom or dad that it's time to hang up the keys. They can't drive anymore because of the kind of cognitive decline or dementia. And you're having a tough conversation, potentially with a tough relationship. We like to provide sort of, not scripts, but prompts, ideas, what that person's probably feeling, what they're thinking, mom or dad are thinking, and how you can best sort of react or frame the conversation to have kind of the right care chat. So it's a really important topic and one we think about a lot. Thank you. Amy asked a question a couple of minutes ago. What do you do when caregivers want to vent but do not want to seek out solutions to problems? Yeah, it's a good one. It's a tough question.
Go ahead, John.
I was just going to say that sometimes with an online intervention, it's hard to vent. And so something we do kind of post all sorts of local events in the portal. So while we know we can deliver skills, if you really need a support group, if you want to vent, and maybe this person is not seeking out solutions, but you need a little bit of either in-person or maybe now web-based opportunities to vent. We know how important that is.
It's worth realizing, of course, venting is important. Actually allowing the person to vent instead of having them search for solutions or something and you're helping them search for solutions. Allowing them to vent is itself a service. The fact is, most caregivers, because of the stress of the role, do need to vent. letting them vent, letting them rant and rave, actually can reduce that stress level. Remember that caregivers are twice as likely to have depression as non-caregivers. In fact, if you're a wife caring for your husband, you are 6 times more likely to suffer depression than a non-caregiving wife. So venting those feelings, those emotions, is hugely important. And if your program is, sometimes stuck letting them vent, realize you're performing a service to let them do it. Especially when you consider that much of what they need to vent, feelings of anger, right? This is not what I signed up for. I can't believe I'm in this situation. Now I feel trapped. Or guilt. I don't know if I'm giving good enough care to my loved one. All those things. We don't want them venting that to the loved one, right? You certainly don't want that caregiver to express that anger to the person they're caring for. So giving them a safe, confidential forum in which to vent is itself an extremely valuable service to reduce their stress level to make sure that their health remains as good as it can.
Yeah. Yeah. Oh, hey, Pam's back. Let's just do one more question, Pam, I think, and then we'll wrap it up. May the caregivers share these resources with other family members or friends who help with care. Yeah, so with Trualta's program, every caregiver has a login. The agency, whether it's a healthcare provider, AAA, insurer, has offered the family the resource. We do let families share their logins. They can obviously invite others to share. We have quizzes and we track progress. So you get a little mixed up if a couple people are using the same account, but we definitely hope that our families share the resources, because we know that often caregiving involves, many siblings and multiple care partners that are helping out. Thanks for that question, Sandra. All right. Pam, I'll hand it back to you. Thank you everyone again for being here. We hope that was a helpful presentation. And again, head to activate.trualta.com to download the ebook. And I know we'll also follow up with an email. So thank you, Midge. Thank you, John. You're great presenters, great panelists, and thanks for joining today.
Thank you. Thank you all. This was amazing information. I was shaking my head most of the time, just as a family caregiver myself, and then going into supporting families for so many years. Spot on with what you are doing and what you have done with this research. I think that, again, it all comes down to we need to empower our caregivers. It's not easy. It's a complex journey. But when we empower them, we ultimately reduce the critical stage of caregiver burnout and all the complexities that come with that can be so destructive to families. And really, this is where I think our hearts are, who are all stakeholders in this. And I can say that no matter where we all are as listeners, you provided some great information to take back for the work that we are each doing. So thank you all very much. I will promise you that we will have more on family education and caregiving, because that is a topic that is always of interest. So don't be surprised if we don't have this group back again. And so I want to let you all know that we'll be traveling to the West Coast next month. And so our June speaker will be with our friend and partner Benjamin Sermi from Kelsch Communities. He is a social gerontologist and director of People and Culture at Kelsch. He is an engaging and amazing presenter. He is going to be talking about rising up creativity in the hope on the front lines, and talking about all the different ideas and creative things that people are doing now in communities to keep people engaged, especially in light of COVID. And so it's the preventing the pandemic of isolation, and he'll be talking about video chat options, sharing stories together, So you will not want to miss it. Benjamin is always great at sharing and always has great ideas. So we look forward to traveling to the West Coast next month. And thank you all again. Reach out to any of us with questions and thoughts, and you will be getting a link to the ebook on the link that we'll be sending out to you in the webinar. So again, thank you all. Have a good rest of your week, and thank you again to the Trualta team and to Caregiver Action Network for taking the time to be on. Bye, everyone.
Thanks for having us, Pam. Bye now.
Bye-bye.